But it boils down to actually even a more serious question, which is, can a child actually make that? Are they competent enough? Do they have the capacity to even make a decision to direct their healthcare, which in my opinion means then, will the parents really ultimately make those choices?
Yeah. In Canada, competency for children is usually assessed on a case-by-case basis. And we don't have a sort of a strict age limit beyond which you're able to make decisions and below which we aren't. And I think that's quite true, because children are very different and they have different levels of maturity and a different sense of who they are. The one thing that is very clear across the board when it comes to making medical decisions is that all Canadians, whether we're talking about children or adults, have the right to accept or refuse medical treatment. And they have the right to make that decision in a fully informed, consensual way, in the absence of coercion and pressure. Right?
Okay. So you mentioned fully and informed, and I think maybe this is where you were headed in a moment. So are Canadians giving informed consent to the vaccine?
To be quite honest with you, I don't think that any Canadian who has received one of the COVID shots so far has been able to give fully informed consent.
Okay, I suspect, and tell me if I'm wrong, it's because these mass clinics. You're not, and I do find it a little strange that I guess it was for efficacy, and you had to. There was a big push to vaccinate as many people as possible as soon as possible. But I know I have seen general practitioners say, well, why weren't we allowed to give that vaccine? We consult, we advise, we have that relationship with our patient. We know their healthcare situation. We want to put their mind at ease. And if we got to do that, then we'd have more, say, vaccine compliance, or we'd be able to answer those questions. You simply don't have that opportunity at a mass vaccine clinic.
Yeah, let me qualify what I said there initially, and then I'll try to explain it a little bit more. So I think in some sense we have the facade or the appearance of informed consent. And I think most people that I have spoken to who have gotten one of the vaccines say, well, I went to the pharmacy, I was given a form, it said something about consent on it, I signed it, therefore I gave informed consent. Right? But consent in Canada is a very complex notion. It requires being fully informed. And one of the things that's important for us to be informed about, perhaps the most important thing, is all of the risks. The risks and benefits that come from vaccination, the risks and benefits that come from the illness that vaccination is supposed to address. Right? One thing that's important to keep in mind is that all of the COVID shots that are on the market in Canada currently are still in their trial phase. They're to be completed in 2023. That means they have not been fully approved. They have been brought to market under, and they're authorized under an interim order.
Right.
And there's a very good reason for that. And that's because the trials have only been going for a year or less now.
Right.
Most vaccines, when they're brought to, by the time they reach the market, have been through a trial process of about 5 to 10 years.
Right. And I think the thinking was that, well, we just don't have enough time. We need to rush this through as quickly as possible, for obviously, and to bring back your original word, because of fear that this virus is going to spread rampantly and kill many, many.
Yeah. And I think what I would say to that is that that's a reasonable concern. Fair enough. If people are really terrified that they're going to be vulnerable to COVID, but it should be up to the individual to make that choice. Right?
Correct.
And in order for them to be able to consent fully, they need to have all the information. They need to know what the adverse event data is, right? And the other component to consent is that it has to be voluntary and free. And that means it has to be in the absence of coercion or duress or pressure of any kind. And there can't be deception involved in that in any way. And one of the problems we're seeing is that there is, in my view, a misrepresentation by our public health officials, by Dr. Kieran Moore, by Dr. Theresa Tam, by our government officials, and I think filtering all the way down through the medical system. There's a misrepresentation of the true risk of COVID versus the true benefits of the vaccines. What we're seeing now is that, the vaccines that are currently available are not having great success at preventing infection with COVID.
Right. I saw some recent numbers out of the United States where they were saying, I think it was about equal, those with or without vaccine who are getting this new Delta variant.